Hear me? I'm Beth, and I know most of you as Eden's mom and Estella's mom, but I'm also an instructional designer, and I work for a public health nonprofit, and I design and develop e-learning courses for continuing medical education. I also, because I work for a small organization, I also administer our learning management system. So that means I do lots of technical troubleshooting, but I'm also the point of contact for all of our providers. So I get to talk to them and get their feedback on our courses and what they like and what they don't like. And the response is overwhelmingly positive to have an online course that they can start, stop when they need to, start again, and it fits right in with their busy schedule and allows them to get more information on conditions that, such as HIV, which is what I do, which are not as well known, but our information is greatly needed. So thinking of last year when I was at Symposium, it was mentioned that there is a need for more education for leukodystrophies. So I contacted Jackie in the fall, and have been working with Anna really since November, December, designing a course based off of a research paper so that we can reach more medical providers. It will be online and self-paced, and hopefully reach more providers to give a better awareness of leukodystrophy to the general medical community. So overall, because leukodystrophies are rare diseases, they go undiagnosed until it's too late. And so in our case, we were able to diagnose, but it took about 6 months for Eden's diagnosis, even though when I adopted her, her disease was fairly progressed. But it still took a long time. And by the time that she was diagnosed, she was in bad shape. And it was hard to get her on a good path to have some quality years with her. So if we can reach more medical professionals, we can diagnose it early. And there are so many more treatment options available now. We can have better outcomes. So the LCN centers, when Eden was diagnosed in 2011, it was amazing to me looking at this last night. I think I'm still missing a few because there was one person I went to, and it was Dr. Escolar. That was our only option, and it was out of state. So that's a whole other issue, especially for families who only have state health insurance. It is hard to get to a center that can help you. And so it was giving her local doctors the information about Dr. Escolar. It still took us probably about a year to be able to be seen by her, and Eden's condition rapidly improved once we had the correct supports on board. But looking at this, the more doctors who know about the LCN centers and are able to just pick up the phone and call them whenever a patient is diagnosed, that will help speed up treatment as well. So the objectives of the course are recognizing some of the more common leukodystrophies and to get the patients connected with appropriate diagnostic tests, and develop plans for referrals and connecting families to the care and groups like Hunter's Hope to be able to have the support that they need. And so the benefits of this course, having the online course, besides more providers in the United States having access, it will give access across it'll be international access as well, because anybody can take an online course. The limitation will be that it will be in English, and so it would have to be an English-speaking provider, but still that opens the door to a lot more providers. But for treatments, it will give a quicker access to treatment for those those families whose children are diagnosed too late for treatment. They will still be able to quickly connect to supportive care and give them a better quality of life and help them get the resources that they need. Local healthcare providers, so just even your pediatrician could take this course and learn more about it, and then know when to reach out to someone else or how to get those insurance approvals, because when they have that knowledge and they can justify, oh, we need to get this person to an expert. And then for me, I called Tara West all the time. I would pick up the phone and call her, and I had providers who would listen to her. And so when they knew, they would ask me most of the time, okay, what did Tara say about this? And so getting people, having that was peace of mind for me, because I knew I had somebody to call at all times. And I knew that my local physicians would listen to what she said. And it gave Eden a really good quality of life. And then connection to community, because when your child is diagnosed with a rare disease, you may think you're just alone. And so when you're able to come to something like this and make lifelong friends, as I have, it puts you in a better place. And it lets you so many things. Sometimes I think, oh my goodness, I'm crazy. And then I come back and I'm like, okay, I'm not. This is all normal. This is just people don't understand who aren't living it and who haven't lived it. So just the overall well-being of having a community, and for doctors to be able to say, okay, your child has been diagnosed with this, you can reach out, or even a doctor or social worker reaching out to Hunter's Hope, for example, and saying, we have this new family. They have said they don't feel comfortable contacting you, but they would be okay with you contacting them. So it just depends what the family needs at that moment. And then the course design, it will open with a family video so that the providers can see people with leukodystrophy as people, because so many times they see the diagnosis on paper and they don't, when they look at your child, they don't look at the child, they look at the disease. And so we want them, they need to be connected with that before they even start learning more about leukodystrophy. They need to see families as families and children as people. And they will, everything will be connected with the course objectives. There'll be knowledge checks to make sure that they are understanding what they are doing, and they'll be able to go backwards and forward. If something doesn't quite, if they need more information on it, they'll be able to go backwards and go back and do the course again if they need to. And then they'll also have access to downloadable materials to take with them, and just like a checklist of these are some things that we see, can keep it wherever it's most convenient for them. And we hope to have this as an accredited course as well. So that's all. Are there any questions? And I'll be here through Sunday, so if you want to talk to me about it, then you're welcome to talk to me.